It's time for our community spotlight. And today with me, Megan Bailey. She's the outreach specialist and NARCAN program coordinator, correct?
Yes.
I wondered if I was going to get this correct. And you're with the Logan Co Health District. Good morning.
Good morning. Thank you for having me.
What is the Logan County Health District? Why is it named that? And what do you guys do?
The Logan County Health District provides programs, and it's a bunch of things, really. We have environmental health that does anything from your septic permits to your well permits or nuisances. And then we have the public health side, which does emergency preparedness. We have immunization clinics for adults and children. And we're just really here for all of your health needs because we strive to have a safe and healthy community.
Okay, that clarifies it very much. That's good. Okay, so what is it that you do as the NARCAN specialist or NARCAN program specialist? I don't know. There's so many titles. You do a lot.
I do. My main focus is coordinating the NARCAN program, which we do through ODH grant, which allows us to keep our community safe and healthy through doing NARCAN trainings and educations, as well as providing NARCAN kits to the community. So I just find different ways to get out into the community where people may need it the most and just try and provide as much education, conversation about NARCAN as I can, and then provide kits to those that may want them, need them.
Yeah, and so I see the billboards about NARCAN, but I've never really been exposed to this side of the world, I guess. And I guess I would need to have some education as to what NARCAN is and when would we use it?
So NARCAN is an opioid overdose reversal drug medicine, and it's used in the event of an opioid overdose, but it has multiple uses. It could be used for the elderly as they may misread prescription labels, children that may accidentally get into medications at home, or those on prescription pain medication. So there's a multitude of reasons why you would need NARCAN. It's not just for what is known to the public.
Okay. And it's just a dose that are you able to just give it, or do you have to get like a emergency person that says, go ahead and give this? How does that work?
So we cover this in the training and the education, but through the training and education, I take you through the steps of how to recognize an opioid overdose, and then how, if you suspect someone is having an overdose, how to administer the NARCAN. And the NARCAN is a nose spray, like your saline spray, allergy medicine spray, where you just spray it in the nose, and you get 2 doses in a kit. You use 1 dose at a time. And we really try to stress that you can give the NARCAN if you have the training or you have the kit, and there's multiple instructions. We give refreshers in the kit as well as in the NARCAN medication box itself. There's instructions. And you have to make sure you call 911 because the NARCAN only lasts in the system for so long, and you do want emergency response to be there to finish up the process and help do what they need to do. But anyone can administer NARCAN. It doesn't just have to be for emergency response.
Oh, very interesting. And just the fact that it's more than what I understood it to be, like you said, opioid overdose, but it sounds like any kind of poison that gets into a system, which is very telling about getting opioids.
As long as there's an opioid that's in the system, it can be from prescription pain medicine. I know I received Tylenol with codeine when I had my wisdom teeth taken out. Getting NARCAN when I was prescribed that by my orthodontist or whoever did my surgery, being prescribed that NARCAN while I was taking that medicine would have been helpful, because when you're taking prescription pain pills, more than likely they do have some sort of opiate in them, and you get drowsy, you get sleepy, you don't realize, you kind of just wake up from when you're taking the medicine, and that's when people run into problems. And more than likely, someone you may know might be prescribed by their doctor on an opiate, and having NARCAN on hand is something helpful because accidents do happen.
Yeah, absolutely. So tell me about the training. How often do you offer it? I know it was down for a little bit because of the COVID situation.
So we always have our virtual training, which if you go to our website, www.loganhealth.org/NARCAN, or if you go to our Facebook page or Instagram, Logan CHD, you can find the flyers that have the link to the survey or the QR code. We always have that training up. It's through SurveyMonkey, and it takes about 16 minutes. It's a virtual training. You watch a video and then you answer a few questions just to make sure you watched the video and you understood what it was asking or talking about. And then we mail the kit for free as long as you provide a valid mailing address. And we always do that. And I did 4 this morning, the ship out. I had people from California, Rhode Island. So it's interesting to see how people, they just search free NARCAN training, but we're really able to reach a lot of people that way. But it also allows for people, if they can't get into the health district, that we can send it to them. And maybe they're not comfortable listing their real name on the SurveyMonkey for the mailing. You can provide an anonymous name, and just as long as we have a valid mailing address, we'll go ahead and ship it.
Very interesting.
Which is cool. But now that COVID is starting to, I wouldn't say necessarily wind down, but cases are going down and we're getting more and more vaccinations out into the community. I've been trying to do our in-person training for the NARCAN classes, which right now our next training is Friday, November 19th at 11 a.m. But I would like to start holding these classes every third Friday of the month, as long as it lines up, because I know holidays and stuff like that. But we have a SurveyMonkey that you can sign up just so I know how many people are going to be there. It's not, just to track. It's just so I know how much NARCAN I need to have and materials. But it's free to participate, and participants will receive not only the training and education, but they also receive a free kit. So that's something I'd like to start doing, where people can come, if they want to, can come into the health district, and we have a bigger class, and just to get, NARCAN out into the community. And it's open for anyone. It's not just, people that may need it, but people that feel like it might be useful, because you never know when you might witness an overdose. It could be, when you're walking down the street in downtown Bellefontaine and you see something happening, having that NARCAN on hand, it's better to have it on hand and, not need to use it than need to use it and not have it on hand.
What about people from outside Logan County?
Yes. So we do a decent amount of training for people that are outside Logan County. If you're in the neighboring counties, you're more than welcome to come in either to the class, do the virtual training, and we'd be more than happy to train you. And another option we do in-person training. If you walk in Monday through Friday, 8:30 to 3:30, ask for Megan, and I'd be more than willing to do the training. It doesn't have to be a setup class, but if you're in town, you're in the area and you want to get trained, I'm more than willing to do the training then as well. And it would just be one-on-one, and you would receive your kit then as well.
Wow. That's very interesting.
Mm-hmm.
And so people can get all the information that you're talking about on your website?
Yes. If they go to www.loganhealth.org/NARCAN, it has the link for the training, any NARCAN information that they may have questions about. But then also, if they have questions, they want to schedule training, maybe a business or a community agency wants to schedule NARCAN training for their employees or their members, they can email me or they can call me and they can set that up as well.
Okay. Anything else that you want to add about this important training?
I know there's a lot of stigma around NARCAN, but it has multiple uses. And I just, want everyone to know it's more beneficial than it is hurtful to get trained and have NARCAN on hand. But yeah, so I can give my phone number. It's 937-651-3033. And that's my direct line here at the health district. And then my email is mbailey@co.logan.oh.us. If anyone has any questions, concerns, or if they'd like to request NARCAN training, anything like that.
Well, and like you said, there may be some things that people say about NARCAN, but go to the training either way, because you'll be at least educated, right?
Yes, you learn a lot, and you never know. It could be a neighbor, a family member that, accidents happen, and you could be the one that saves a life that day.
All right. Well, that's really great information, Megan. Thank you so much for educating me as we're sitting here.
Yes, of course. And if you want a kit, you can come on down to the health district and I can do a more in-depth training and get you your own kit.
Interesting. Okay. Well, might be doing that.
Yeah.
All right. The website one more time is Logan County or Logan Health.
LoganHealth.org.
LoganHealth.org. Okay.
To get to the NARCAN, it's loganhealth.org/NARCAN.
All right. Thanks, Megan, for your time today and educating us about NARCAN.
Thank you so much. Thank you for having me.